PRN medications in implementation.
In the implementation station of the NMC OSCE, administering PRN, as required, medications requires careful attention to ensure safety and compliance with the marking criteria. Here's how to handle PRN medications effectively. Review the prescription chart. Check the PRN section of the prescription chart. Verify the indication for the PRN medication, example, pain, nausea, etc. Confirm the time interval since the last dose was administered to ensure it's safe to give another dose. Assess the patient's need. Identify if the patient has expressed a need for the PRN medication, example, pain, nausea, etc. Check the medication details. Ensure the right drug, right dose, right time, right route, and right patient. 5 rights of medication administration. Confirm the expiry date of the medication. Documentation. Record the time and initial for administration in the PRN section of the prescription chart after administration.
More updates are on the way. Like, subscribe, and turn on notifications for the latest updates on the syllabus and materials on OSCE. Stay tuned for insightful videos.